I'm just going to, so I can send to my wife. Go on, it's all right.
The gas that we put here in your eye, it goes away on its own after about a week.
Okay.
Okay.
Uh-huh.
So during that week, you need to not necessarily as much as you can, but you don't need to torture yourself. But what's important is to not bend forward to avoid the gas going backwards.
Okay.
Okay.
Yeah.
So if you do your laces and stuff, don't do them. Basically, have shoes with no laces.
Okay. Yeah.
And also don't go in altitude, because in altitude the gas expands.
When you say altitude, Annecy's okay.
Yes.
600, but
yes,
don't
that's
go
fine.
up.
Here
Don't
we're
go.
450. That's fine.
Okay.
Basically, the risk is that it could increase the pressure in your eye and create and damage the optic nerve.
Okay.
So if you go and see, if you start to feel that.
But we're only talking about the first week or two.
Yes,
yeah?
just the first week. This is gone after a week.
Okay.
But if you go to and see, if you realize that you start to have pain in the eye, then go back down. Go
to
back
Paris.
down in altitude. No, just here.
Oh.
Because here we start at 450.
Yeah, but Annecy's only 600.
Yes, but I'm just telling
Yeah.
you, just in case.
Anyway,
you start to
just in
feel.
case. Okay.
We keep you 2 nights at the clinic. 1 or 2 nights. We'll see that with the secretary. So we do the surgery. In the clinic is right across the street there.
Oh, is that there?
Yeah.
Okay.
You stay at least 1 night. The nurses, they look after you, they put the drops, etc. I see you the day after.
Yeah.
And then I see you a week after, a month after, etc.
Okay.
Okay. Most of the grafts, they stick very well.
Yeah.
But some grafts, for some reason, they have more difficulty to stick. Sometimes it's just a question of going back to theater, injecting more gas to push it. But sometimes even with gas, if they don't want to stick in those instances, which is rare, we change the graft, which is the easiest part again. It's the fastest part of the surgery.
So where are you going to get the graft from?
The graft comes from the local Cornell Eye Bank.
Okay.
No, again, very rarely, some grafts, they stick, but they don't pump. It's very rare, but it can happen.
Okay.
In those instances also, we wait a few weeks to see what's happening, because some grafts just take longer to pump. But if they really don't pump, we also go back to theater and we change for another graft.
Okay.
But in most instances, like 99% of patients, they stick well, they pump, and after 1 to 3 weeks, the cornea is clear.
How long does the operation take?
30 minutes?
30 minutes.
30 to 45 minutes.
Okay.
And it's a local anesthesia, so just an injection around your eye.
Oh, okay. Only local, yeah.
Yeah. And
that's good,
a
because
little sedation if you need.
because what happened after, so I come out of surgery, yeah. My wife, the doctor rings my wife, everything perfect, even though the medical records show what they did. And then they pushed. Was taking 120 milligrams of prednisolone for a month. And after a month, I hopped in a plane and ended up with a blood clot. Yeah. So if you're only giving me local anaesthetics, not a problem.
Yeah. No, just local.
And maybe a sedation.
If needed. Sedation is not necessary. It's if you want to make you more comfortable.
Okay.
But that's everything that's to do with what anesthesia we can give you.
Yeah.
Generally, it's the anesthetist who will decide. They will look at your file. They will say this we can do, this we cannot do.
Okay.
But we don't need a GA. So.
Okay,
Okay.
If you do clear tear ducts, do you do the same thing? Yeah. Oh, you don't do cleared.
I don't do that. If I do just rinsing, I do it here in the CT lamp. I just put drops.
Yeah. Okay.
All right.
Okay.
That's it.
Wonderful. Okay. All right.
Here with the glaucoma, because we have glaucoma service.
Yeah.
They put tubes in the eye for the glaucoma and stuff. Or sometimes there's no lens, or sometimes there's no iris. Those are complex because they are difficult to do.
Mine's simple because
exactly.
it's straightforward.
Anatomically, it's simple, it's straightforward. So.
Okay.
Yeah.
You'll send me your website?
Yes. I'll give you my card.
Yeah.
And here's the website of Swiss Visio.
I did search you online to see whether.
But this is not my website. This is Swiss Visio website. But if you search on Google Dr. Arthur Hammer, you find my website. It's the first result. Okay. And the website is drarthurhammer.ch.
Yeah. Okay. Wonderful. Okay. I'll have another look. See, There's no way I could read that at any.
Do you want me to give you a prescription?
Give me a prescription, and I'll go down to in France and see if I can down there sit and see what I can do. Yeah, it's
That's fine. Let's do that.
But